Okay, apologies everyone for our slightly delayed beginning. It's our first webinar of the season, and we're trying to do French interpretation. We're hoping we'll have that functionality for you. However, it may not work out today, so my apologies in advance if that's the case. We're very excited and honored to introduce to you Petra Schulz, who will be presenting our first webinar, family advocacy in the midst of the drug poisoning crisis. And I know that you are all going to be moved and riveted by what she has to share with us today. It's an incredible honor for her to be here with us. Just wanted to remind everybody that if you haven't registered yet for the main event, and we have two more webinars coming up on October 30th as well as November 6th, we encourage you to do so. You can find all the information, what's available on our agenda so far, that will be updated constantly, our speakers' bios, and registration links by going to patientsredefininghealthcare.ca. We want to give a really deep thanks to all of our supporters, our sponsors who make the webinars as well as the summit possible. So a huge thank you to Janssen, Merck, Pfizer, Roche, Sanofi, Amgen, Bristol Myers Squibb, AstraZeneca Canada, Novartis, and as well, Innovative Medicines Canada supports our working groups that for those of you who've been at previous summits, and some of you may be part of those working groups, we patients and caregivers volunteer coming out of each of our summits to continue working on common issues together. And it's with the support of IMC that we're able to do that together. So a huge thanks to all of our supporters and to all of you for being here today. So throughout the webinar, we ask you to keep yourself muted and videos off. We are recording, as we will be making the video available to people who couldn't join today through YouTube. Um, so as I just mentioned, the session is being recorded in English and French. We were hoping to be able to offer French interpretation. If it starts working, you'll be able to access it by clicking on the world icon at the bottom of your screen, muting your original audio, and selecting French. Apologies to any of our Francophone participants here today. If it's not working, we promise we'll have that resolved by our next webinar. If you have a question that arises at any point during the presentation, please just put it into the chat box. And as moderator, I will notice it and then bring it to Petra's attention after she presents. And if you have any technical difficulties during the webinar, please contact Lance Lee via the chat function for assistance. And last but not least, please help us spread the word. If you're inspired by what you're hearing from Petra today, please share it on social media. Here are some hashtags that you can use so that we can start the conversation and really help frame up Patients Redefining the Future of Healthcare in Canada for this year, starting now with family advocacy in the face of the drug poisoning crisis. So just give me 1 second as I give Petra the necessary powers. You're on mute, Petra. So if you just want to, there you go.
Thank you, Leah, for the kind introduction and the opportunity to speak to all of you. Before I will share my slideshow for my presentation, I'd like to begin with a land acknowledgement. I myself, I'm an uninvited guest in Emiskwacis, Weskahayakan, Beaver Hills, colonially known as Edmonton, which is in the Treaty 6 territory in Métis Region 4. And here we are on the traditional land of many First Nations and Métis people, including the Cree, Blackfoot, Lakota, Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, and many others. We consider ourselves treaty people here. And as an Indigenous friend once explained it, is if you do a land acknowledgement, you should think about the land you're on as if it is your mother's house. So we should all be treating the lands as we are in our mother's house. So with kindness and respect and with love. So now I will be sharing. Actually, I should first have that on the presentation mode. That makes it easier. The first slide. Okay, so share screen. Okay, everybody good with the slides?
Looks great.
Yeah, okay. So I would like to speak to you about family advocacy in the midst of the drug poisoning crisis. When I speak, it always starts with my story and the story of our son, Danny. Um, And in illustrating our advocacy work, I want to share a little bit about Mom Stop the Harm, what we do, what we stand for. And our media work, I have found to be a good way to illustrate the advocacy work that we do because much of it is documented there. So I will take you through some of the media work we've done and some of the initiatives because advocacy for any group, patient advocacy, advocacy in the drug policy word, well, it's about raising awareness for an issue that people often don't pay attention to, don't think about until it affects them. And that is what was the case with us. This is our youngest child, Danny. It's hard to think for me that it's almost been 10 years since we lost him. I think about him every day, and I always think about how different the outcome for him could have been. Danny, as the youngest, he was different from a lot of kids, even as a small child. When he was 3, he wanted a cactus for his birthday. When he was 8, he wanted a gold panning kit, and he thought he'd find riches in the North Saskatchewan River. When he was 14, he bought his first old car together with his dad, a little Chevette. And in his short life, he had many cars that he called vintage and I considered kind of old. Danny also had some struggles. He was, as a student, he was diagnosed with a learning disability. And the disability world is my field where I taught professionally at MacEwan University. And what I taught my students that people with a learning disability often have difficulty with something called executive function. And that means in planning activities, getting organized, but also means struggles with anticipating the consequences of action and with impulse control. And impulse control and anticipating consequences, certainly something Danny struggled with. At times when I asked him, Danny, what were you thinking? He'd answer, I was not thinking at all. It just seemed like the right thing to do at the time. In addition to his learning difficulties as a teen, Danny came out as gay. And yeah, even today, I think a lot of teams, even more so today with the kind of stuff that is going on in social media and with protests that are happening. It's hard to be a kid who's gay in high school and in junior high. And he certainly struggled with that. And later we learned that he also faced some bullying and harassment. Um, in addition to that, he was struggling with mental health issues and he began to self-medicate unbeknownst to us. Like many young people do, it's hard to get the right treatment at the right time and the right way for mental health issues, especially for our teens. And Danny was one of the many that struggled with that. Um, Danny, he always loved cooking, and when he wanted to go to culinary school in Vancouver, it kind of seemed like a logical step. As already in high school, he had worked in restaurants. He was working as a dishwasher, going on to line cook, prep cook, and eventually, even before he got formal training as a cook. Um, to to get into college, he had to do some high school upgrading, and he found a strategy that worked for him. He loved social and he loved politics, so he would always have a social class before the English and math class, which is what he really needed. So I think he probably did social 33 times in order to pass his English and math. He was accepted into culinary school in Vancouver, and initially things were going great. He was winning cooking competitions. He told me what he did. He shared recipes, but eventually we heard less about what was going on and in school, and we had a sense that he had difficulties, but we weren't really sure of the nature of those difficulties. He was in an accelerated program, so they had 10 weeks off, 2 week breaks, and those breaks would be in restaurants. So he only once for a brief visit came home to Edmonton during that time. um, One time I spoke to him and he said, "There's something I need to talk to you about." And he sounded worried. I was worried. And when the call finally came, Danny broke the news to us that he was addicted to heroin and he was in trouble. He had spent his entire student loan and couldn't pay the tuition for the upcoming semester. Um, his boyfriend asked him to leave, so he had no place to live. So he was definitely in trouble and he needed help. We helped Danny get home to Edmonton. In the picture, you see him graduating from culinary school um, in in 2011. He managed to finish culinary school. He had to drop out of restaurant management. So we brought him home to Edmonton, and Danny detox in our living room couch. And anybody who's ever seen somebody detoxing without medical assistance, it's really quite a horrific experience. And I thought Danny would do anything in the world not to repeat that. But I didn't understand, my husband didn't understand how substance use works, how substance use treatment should really look like. We didn't know anything about harm reduction. There's much we didn't understand. Danny went through a cycle of detox and eventually went back to Vancouver. Um, his use got worse. He started injecting. But in Vancouver, a friend got him onto opioid agonist treatment, or sometimes called opioid substitution treatment, with methadone. Um, for us, methadone, we saw it as a medication, but kind of as a temporary step to get our old Danny back. So we would ask, "Hey, Danny, how long do you have to be on those meds? Are you tapering yet? What dose are you on?" We really encouraged Danny, or maybe even pushed, to get off his meds much sooner than he should have. I've since learned that people need to be 1 to 2 years stable on their medication before they can look at tapering. And some people stay on their medication for life. We don't expect people to go off their blood pressure meds, and we don't expect them to go off their diabetes medication. And medication for substance use and opioid use in this case is just the same. A good friend of mine who makes an amazing podcast has been on methadone for 20 years, and you'd never know that this is the case. So with Danny, he came home back to Edmonton. He got a job in a restaurant. He got his own apartment. But because he wasn't quite stable, he had relapses. And one time, at the end of a trip he had taken with his dad, I picked him up at the airport late in the evening. He had come back on his own, and on the drive home we had a really good conversation. But he said to me, "Can you make an appointment with my doctor and my psychologist again?" Now, Danny wasn't good at making appointments, and we had agreements with his health care providers that I could make those for him. I felt like asking Danny, "Are you using again?" But I knew that wouldn't have been good. He would have been upset with himself and upset with me. So I just let it go. I made the appointment the next day. In the afternoon of that day, I couldn't reach him, but he had an early shift, and I thought, well, he came home at midnight. And when he came home, I have to explain, as clean as he was in the kitchen, he was messy in his apartment. And I'd gone in, I'd cleaned it up for him. I bought him a new shelf. He liked mid-century furniture, and I'd found this beautiful teak shelf that I still own. And I put his cookbook in the shelf. And when I showed it to him, he said to me, wow, so much room. I need more cookbooks. And as I left, he said, I love you. And I said, I love you, sweetie. So the next day when I couldn't get a hold of him, I thought, came home after midnight, worked at 7 in the morning. He probably just needs to rest. The day after, when I couldn't reach him, I felt like phoning work, but um, calling the restaurant where your son works, one of the best restaurants in town, and saying, hey, did my son show up for work? Is not a good thing to do as a mom, even if that's what I felt like doing. By the late afternoon, when I hadn't heard of him, my husband and I drove to his apartment. I knew the key code and I knew how to get in. And there was no sound. No, I couldn't. There were signs that he should be home, but no sound of Danny. And then I saw a light coming under the door, and there was no sound from the bathroom where I saw the light. And I knew that the day that I had dreaded so many times had come. Um, Families who have a loved one they live with something called anticipatory grief, where we, in our mind's eye, in our nightmares, see our children um, die many times before they do. After Danny's death, we had difficult decisions to make, but when we decided to be open about the cause of his death, it was like floodgates opened, and so many people in all spheres of our lives had shared that they had a loved one who struggled in similar ways, using substances or in other ways with mental health. So that really brought it home to us how stigma and shame keeps people in silence. And we decided to be open. I started to reach out to media to break the silence and the stigma. And through these media stories, I was able to connect with my fellow co-founders of Mom Stop the Harm, Leslie McBain, who lives on Pender Island, BC, and Lorna Thomas, who also lives here in Edmonton. These are some of the images of our the loved ones that members of Mom Stop the Harm lost. We now have close to 4,000 members across the country, and our gallery that I'll speak about in a moment shows so many beautiful faces of loved ones we've lost. Substance use and overdose or drug poisoning is something that can affect anyone, but some people are affected more than others. In the province of Alberta, Indigenous people are stunning 7 times more likely to die than non-Indigenous people. And when we have Truth and Reconciliation Day, this is always a significant fact for me that I feel we cannot talk reconciliation and idly stand by while so many Indigenous families are grieving, often more than one family member. In Canada, a staggering 20 Canadians die every day. It's more than 5 people in the province of Alberta. We started keeping track, the government started keeping track of numbers since 2016, and the numbers we have here are until March 2023. So by now, we must be close to 40,000 victims of this crisis. Most of the deaths are in BC, Alberta, and Ontario, but there are other regions that have high rates, like, for example, the Yukon territories. Most are young and middle-aged males. Here in Alberta, 70 to 80%, depending on the month, a year, of the victims are men. Many of whom work in trades. And the toxicity of the supply of drugs is a major crisis. People are not dying from prescription drugs, or very few do. The vast majority in Alberta, about 95% of the deaths, are from the illegal street supply, and numbers are similar in other provinces. Now, how did we get here? I illustrated in Danny's case how personal struggles, mental health, personal trauma can affect people, and they use substances to cope. Stigma and discrimination stops people from reaching out for help, and lack of treatment means that people cannot get timely help when they need it. Lack of access to harm reduction services means people are not kept safe when we did. The role of pharma, when Danny started using, he had access to pharmaceutical substances. He could buy oxycodone, OxyContin at the time. Um, but while he was using, we didn't even know he was using. The overprescribing at the time gave more people access that shouldn't have had, and more people developed problems. But we didn't have the number of deaths we have until fentanyl arrived on the scene, when oxycodone was reformulated in 2012. Right now, we have an inverse relationship. As prescribing goes down, death rates go up as more people turn to the street supply, including the people who use for pain. There is something called the iron law of prohibition. You've all heard of the war on drugs. You've probably seen something on Netflix about alcohol prohibition. And whenever there is a crackdown, substances get more concentrated, they're easier to smuggle, profits are higher, but they also become more dangerous, more concentrated, more lethal. And even the London School of Economics has done an economic analysis of the war on drugs and considers it an economic failure. It is certainly a social failure and a failure of health and drug policy if you consider the many people who have died, and we have no positive outcomes to show, only money spent, more people in jails, and more families arranging funerals. So together with Leslie and Lorna, we started on this journey and developed this network of Canadian family impacted by substance use, really substance use policy related harms and death. What we do is we advocate to end substance use related stigma, harms and death, and we provide peer support to families. Here you have an example of a rally in Edmonton, and a small hint, this was during COVID, as you can tell by the face masks, and also one of our grief groups as we gathered before Christmas to decorate cookies to take to one of the local shelters. Our family support groups, and I encourage you to check those out and tell anybody who might need help to look up our groups and join. Healing Heart groups are for families who have lost a loved one. Holding Hope groups are for families who have a loved one who is using or in recovery. What we advocate for is because we understand what we have is not an addictions crisis. People are dying, are people who use for the first time and people who use every day. Some people who need treatment and some people who only use occasionally and never need treatment. So it's a crisis of an unregulated drug supply, not a crisis of the addiction. So we have to provide regulated alternatives to stop the deaths. We also advocate for the decriminalization of people who use drugs. You've probably seen reports about decriminalization in BC. Decriminalization is not what will stop the death if we don't also have access to regulated substances. But decriminalization takes the criminal system, takes police out of the lives of people, and reduces stigma and allows people to reach out for help. Harm reduction initiatives like supervised consumption sites, naloxone, the antidote to overdoses, clean supplies like needles and syringes. Harm reduction keeps people safe, and harm reduction gives people hope. We need rapid access to evidence-based treatment. Research tells us that you have a 2-hour window when somebody tells you they need treatment. At very few places in the country can we get anywhere with a 2-hour window. And we have to work on upstream prevention to deal with issues such as poverty, houselessness, mental health issue, and the traumas so many people live with. And for you, this should be an important point, the last one, that meaningful inclusion of everyone affected in all decisions. That means people who use drugs, as well as families in the case of drug policy. So whatever your causes that you are championing, you should be meaningfully included by policymakers. So as I mentioned before, we use media in our advocacy. We use it to reduce stigma, showing the personal impact, to advocate for specific issues, to draw attention to the magnitude of the crisis. And I'm sure there are people here who did not know how many people died every day. To work for the policy change and fight what I call post-truth attacks that come from political corners who use our cause as a vehicle to gain traction without basing their statements on facts and making statements that are harmful to people. So what we do, we use all media available, newspaper, radio, television, alternative media, podcasts. We have participated in documentaries, magazines, and more often now we use blogs, especially since Facebook is blocking media. And Facebook has been, especially in the early years, very important for us to get our message out. Now we do more from Instagram. We are also on X, previously called Twitter. So here are some examples. Initially, it was drawing attention to the crisis. The first story about Danny was shared in the National Post, where I submitted basically what was a summary of his obituary, or well, I had to reduce the obituary my husband wrote from 5,000 words to 500 words, which was a huge challenge. But the first time the National Post published, rather the Globe and Mail published his obituary, when I saw that in the paper, I thought, wow, he mattered, his stories matters. And a bit of the pain was lifted momentarily, and I felt sharing his story could make a difference. And then we again shared his story in a local paper, and that's how, as I said, how we connected, as did other families. We advocated for specific issues. When we started out, naloxone, which is now widely available, that's the antidote that you can safely give somebody to reverse an opioid overdose. That it wasn't readily available. And our first issue that we work towards, together with our allies, we never work alone. We work with allies, especially those led by people, groups that are led by people who use drugs. So what we did, we called for naloxone to be available free and over the counter, which was the case is the case now for several years. And we worked for the 911 Good Samaritan law, which is sort of a little bit of decriminalization where you're not currently charged in the case of a 911 call. We also speaking out against involuntary care, which is something that is on the horizon now. And I'm happy to answer some questions on that if you have any. Decriminalization and what's dubbed safe supply, safe regulated alternatives. We have one of our members, a mother in British Columbia, Jessica. Jessica ran a marathon every day for an entire month about the Ministry of Mental Health and Addictions in Victoria. And she also ran from Nelson in the interior of British Columbia through BC and northern BC, and then down the island again to Victoria to draw attention and calling for safe supply, which is what she feels would have saved her son's life. We sent pictures. We sent over 500 pictures of loved ones to Prime Minister Justin Trudeau. That was an initiative we had in 2017 where we called for action. And we held rallies to call on decriminalization. Other initiatives, in 2021, we sent seeds, poppy seeds for change, poppy seed for us. Um, Poppy is remembrance, but poppy is also the opium seeds, and represents safe supply. So we had these purple envelopes with poppy seeds, and we sent 25,000 poppy seeds to the Prime Minister. He gets more unusual mail from us. Then on the right, you had one of our groups in British Columbia. They held a vigil and they made mock-up coffins that had the number of people that died, here in this case from 2015 to 2022. Again, a way of illustrating and drawing attention. Media attention is fickle, and then you have horrific international events happening, like the war in Ukraine and the situation in Israel and Gaza. Um, and you fall off the agenda, so you have to find ways of getting back on the media agenda. And the bottom, we participated, there is a group in Vancouver called the Drug User Liberation Front. They have a program where they give tested and safe substances to members of a compassion club. A lot of cannabis, medical cannabis started with compassion clubs, so kind of the same idea. And they've recently released finding that they haven't had, in 2 years, they haven't had a single participant have a drug poisoning event, or a single, more importantly, not a single participant die, that many participants are more engaged in life, have found work and stabled their life. So very important finding. So we participated with them by helping give out safe regulated supply as an event in Vancouver. This was a very, very powerful and moving initiative that we had across the country. We had moms stand in historic places, or sites that were meaningful to them, with crosses resembling our loved ones. First, in Kelowna, BC, the photo on the left. The photo on the top is on the land of the Blood tribe in southern Alberta, in particular the Piikani First Nation. And on the bottom, that was in Edmonton, Alberta. These images really raised a lot of attention and were a powerful symbol. We have stopped doing them since the graves of Indigenous children were found. We found that our images might be too painful and might be conflated. So I wanted to show this to you as both a powerful, very effective campaign, but also you always have to look at your campaigns in the context of what else is happening in society. We work closely with media. They reach out to us a lot, and we connect them with families who might be willing to share their story. Here, the Globe and Mail published the faces of 200 individuals who died. And many of those were Mom Stop the Harm members. So when we work with media, when they come to us, we try to help them. And then when we have something and reach out to them, they help us get our story out. So it's really a partnership, and we have media allies that are champions of our causes that we reach out to. We have key events that we get media attention to. One of the most important every year is International Overdose Awareness Day. It's a global event. It's held every August 31st. We have events from Newfoundland to Vancouver Island. And here you just see the examples of some stories. What we do for International Overdose Awareness Day, we have historic icons, not historic, but iconic buildings or structures in cities lit up. The High Level Bridge in Edmonton. This is a teepee in Medicine Hat. We had the Museum for Human Rights in Winnipeg. We had the CN Tower lit. So this is always in conjunction, sometimes led by Mom Stop the Harm. Sometimes we participate with our allies. Sometimes we attend the events of our allies. The photo on our left, and is also taken in Edmonton, where we have a gallery of photos of loved ones that we put up. Our Edmonton event this year drew nearly 500 people to a park who all came there to collectively remember our loved ones and draw attention to the need for change. And the theme this year was See Me. Here we have again the story about Jessica's run. Um, and what the work she did. So we get the story out in smaller communities within initiatives like Jessica's Run, because she had to stop at every community along the way and local allies came out. At Christmas, we have memorial trees that we place in public spaces. A lot of times we target hospitals, hospital lobbies, because they have trees up already. But we've also gone to malls, City Hall, wherever we can find partnerships. And what we have done here in Edmonton, when we put up the trees, we have a way of either having others in Red Deer. What they did, they had little purple hearts, and people could write names on it. And in Edmonton, we had a canvas where people could write names on. And in Red Deer, they cut out 200 purple hearts that were gone in a weekend. It was just and the heartbreak is just so immense, and so many people are unknown and unnoticed, and families want to express their grief and want to make the name of their loved ones known. In Edmonton, our canvases filled up quickly. Another way we did is on the left, we looked at phrases as to loved ones were described. This was an initiative spearheaded by one of our academic allies, Professor Rebecca Haynes-Saw at the University of Calgary. Rebecca and I, we spent some time over COVID Christmas when we couldn't go anywhere. And we combed through obituaries. We combed. On the right-hand side is an example of the gallery we have on our Facebook page, where we share images and profiles and stories of our loved one. So I combed through our gallery, and in many tearful hours, I pulled out these phrases that you see on the left, and we have shared those in many places. And I often use these phrases as well to read them out to close off events. Finding new audiences. I'm very pleased to speak to you, because this group is a different kind of audience to us, although I know that some of our Mom Stop the Harm members and supporters and allies are attending today as well. But new ways of reaching out. Leslie and I got a call from Chatelaine. First, I thought it was a prank call, but it was really Chatelaine, and they shared our stories. And the BBC featured our story in Outlook. So that allows us again to raise the profile and reduce stigma. We participate in documentaries and podcasts. Crackdown podcast, if you want to delve more deeply into how people who use drugs experience the crisis, especially at the epicenter in the downtown east side in Vancouver, I highly recommend Crackdown podcast. It's excellent. And you can check out these documentary, Painkiller Inside the Opioid Crisis with Telehealth, that's on YouTube, as well as the documentary Flood. The post-truth attacks that I mentioned, this is a quote from the leader of the Conservative Party of Canada. And so many times we get attacked, we are called activists. People say we are paid off by the drug company. We are not. We don't take drug company money. And yeah, people are called public health bureaucrats. But what people like Mr. Polyev don't do, they don't consider the evidence. We always point to the evidence. Everything we do is based on our personal experience combined with research finding that drives our policy, drives our actions. And it is heartbreaking to see statements like this and to have evidence-based actions attacked. For example, in British Columbia, less than 5% of people who need it have access to safe supply. And safe supply is not driving the death. Excuse me. So the lessons that we've learned, our successes, our stories, our images are powerful. That's the driver. That's how we have to start. Excuse me. And that's where we begin. The voice of the family is an important one, and people are prepared to listen. So if no matter what cause you represent, bring your voice forward, get policymakers' attention. They have, it's really hard to slam the door in the face of a grieving mom, although some politicians do even that. Mr. Polyev has refused to meet with us. It's hard to slam the door in the face of a grieving mom. So we get these doors open and we speak to people and we share our experience. We share the evidence with them, start a dialogue. We constantly try to mentor new advocates because this is difficult. It's hard work. It's tiring, it's exhausting. And I often say we are a group of wounded warriors. And yesterday I got sad news from the friends of one of our children, and it just kind of knocks you out, knocks you off your rails. You have to be creative with the ideas and actions, always coming up with something new to say, hey, this is still a problem. We still have to talk about this. And you have to work with allies like user groups of, in our case, people use drugs, with academic allies, with allies in the health profession, with allies that are for similar causes. Like, for example, people who fight for public health care are often good and strong allies in our cause. Even in the climate change movement, we find allies who have learned how the war on drugs has affected, negatively contributed to the climate crisis. And then, of course, the allies in media. The challenges we have that, especially media, and it's powerful to focus on emotion, and the emotion that can be difficult, and it's hard. When I'm done this talk, Danny will still not come home. And that is hard. Sustaining the attention, as I said, self-care is something we practice, and that's where our healing heart and holding hope groups are so important. My friend Angela Staines, and my friend Angela Wells, when she first said that we need to have grief support groups, I said, Angela, I need to do advocacy. And she said, but how will you sustain the advocacy if you're not well? So that's how our group started. And Angie Staines, by the way, is another close ally who does lots of street outreach work on the ground, one of our board members. Diversity is a challenge. It is harder for people to speak out if you're already in a group that is equity deserving and marginalized. So we are building bridges. We are working closely with Indigenous groups to have Indigenous versions of our manuals, for example, for Healing Hearts facilitators. We have Indigenous people working to build groups, and we are mentoring Indigenous people to join our leadership, and we are looking to do more of that. Social media has become brutal. And I used to go through my Twitter replies to find people I should follow. Now I go through and find people I should block. I engage with anybody who is willing to engage in an honest and open and respectful dialogue. I don't engage with anybody who tells me our children deserve to die. And there are many people in the harm reduction movement and physicians who are saving our children's lives, who are facing personal attacks and even threats. And that is just horrific, and it is unacceptable, and we all have to speak out against this. So why do we continue sharing our stories? We hope to open hearts, and that opening hearts will lead to opening minds, and that that will lead to changes in drug policy and ultimately save lives. With every measure we look at, we ask, will this save lives? Will this save lives? Will this help families? For me, it reminds me that if I had known more about harm reduction, if a consumption site that was later opened 5 minutes from where Danny lived would have been open, there are many things that could have saved his life. And when we keep people healthy and alive, then there's hope for the future. And we miss Danny tremendously. And with him, so much has changed in our family. And I do whatever I can to stop this from happening to other families. I'm glad you're here and that you joined us this morning or this afternoon, wherever you are. Here is some information on our websites and our social media. Please check it out. You can contact us at info@momstoptheharm via email as well. And I think we have a bit of time for question. Yes, I left time for questions. So I stopped sharing, and don't be afraid to ask questions. You can put a question in a chat, or I don't know, Leah, how you'd like to do your questions.
Yeah, thank you so much, Petra. Well, encourage everybody to put your questions into the chat, and hopefully I will have the correct powers to see them. So please don't be shy. And I just want to thank you so much, Petra, for your incredible presentation, but really fundamentally
Yeah,
your bravery and your resiliency and being able to continue to take care of yourself and be able to find the strength in the face of so much ongoing difficulty and grief to do this work and to to really help build this movement that is national and growing.
thank you.
And just I,
Yeah.
I literally had to clear tears off my face listening to your to what
Uh,
you shared today, and I'm extremely moved and
Oh,
motivated.
the chats. It seems
Yeah.
like the chats are disabled. So there are some
Okay.
comments and questions. Yeah, if you want to
Okay.
put your
Good.
the Q&A is on, so you can put any comments or
Great.
questions you have. Yeah, thank you, Leah.
Here we
So
go. I see it here.
thank you for your kind comments.
Thank you. So you see the comments that
I
are
see the
coming in here.
comments. I think there
Here's
was
one
also
question.
yeah.
Yeah, here we have one question. Oh, there's two questions. So thank you so much for the incredible presentation and the work that you're doing in Danny's name. You talked about the goals that Mom Stop the Harm advocates for, including safe supply, decriminalization, upstream prevention, among others. And you also talked about some of the challenges you've encountered in your work, things like post-truth attacks. What do you see as the biggest enablers and the biggest challenges right now to achieving these goals?
Um, I think I see as the biggest challenge a lack of willingness by political leaders to do what is right. Because of these attacks that are coming from the right, even some seemingly progressive governments walk things back. Like BC just made changes to their decriminalization project that I call recriminalization. Right now, you have a higher chance to be arrested for drug use in Vancouver than in Toronto or Edmonton. So I see that as a huge challenge, the propaganda against effective methods like harm reduction and safe supply, and countering these, because some of this propaganda comes with 60 minutes professionally produced videos. Like, who has
Mhm.
funding to do that? We don't have the funding. And the other one is continued funding for our programs. Many of our programs are federally funded. Only in BC do we get provincial funding for our work.
Yeah,
We are hopeful that
interesting.
might change in Manitoba, fingers crossed.
Oh, one of the questions that's coming here, and I think it's some of the messaging that some of
Mm,
the non-evidence based post-truth
mm,
attackers use is you mentioned involuntary treatment, and
mm,
that's often what they're saying. Well, that's what you should be doing, right? You should
yeah,
just be
yeah,
requiring people to receive treatment.
yeah,
And so there's a question here. Could you share a bit more about the
yeah,
issues and why your group doesn't support forced treatment?
yeah. Um, forced treatment, there is a lot of research that shows forced treatment is not only not effective, but it's also dangerous. A lot of the forced treatment is abstinence based, and then when a person ends a treatment, a week, 28 days, whatever they're sent for, um, and then they start using again because they weren't motivated to stop in the first place, then they're at a high risk of overdose. We also feel that forced treatment will drive people more deeply underground. Here in Alberta, there's a proposal where a family member, law enforcement, or a physician could send a person to treatment. The most dangerous thing to do is to use alone, because then there is nobody there to save you if you have a drug poisoning event or an overdose. And forced treatment is more likely to drive people underground. We also don't understand, we can't get treatment for people who want treatment. Like, who gets ahead of the line? Do people who don't want treatment get ahead of the line for people who actually want it? We should focus on making treatment readily accessible and evidence-based for people who want it at the time when they want it. And that is, we also have families who've experienced with forced treatment, for example, for children. There is a blog post from my friend Angela Wells, The Trouble with PCHAD. I encourage you to look that up. So there's a lot of evidence against it. I'm not aware of any studies that show of their effectiveness. And we've also heard from healthcare professionals who said, a nurse I know who works in detox told me, if you force me to take people into detox who don't want to be here, I'm out. And that is another challenge. I've heard from ambulance drivers who said, I don't want to take people to treatment who don't want to go. So there are a lot of issues around
Yeah,
that.
thank you for helping explain that for people. A good question, from Louise, what can we do as patient groups and caregiver groups to help support moms stop the harm?
Excellent question. What we all need to do, we all need to be allies for our causes. We all want evidence-based, accessible, quality healthcare for our loved ones. We want drug policies that meet their needs. So if there is a local event, reach out. If you can reach out to your MPs, to your MLAs, check on our website. You can sign up on our newsletter on our website, where we keep you up to date if there are specific causes that we champion and contacting politicians for. Come out to International Overdose Awareness Day or other events and show your support. But signing up on our social media and newsletter is a good start, just to kind of get you in. You don't have to be affected as a family to be part of our group and to stay informed.
Good to know. So we would, if we sign up and get ongoing
Mm,
information about
mm,
opportunities to join a
yeah,
campaign or to lend our
exactly.
voices and
Yeah.
support. Wonderful. Um, a question that's a bit personal. Do you have to be a parent to become a part of your organization? My niece has been struggling with addiction for 10 years.
No, you don't have to. If I would do it again, we wouldn't call us Mom Stop the Harm, but now it's hard to rebrand. We probably say Family Stop the Harm. And when we say families, we define families widely. It's your blood relation, your acquired family, and sometimes friends are family. We have one of our board members was brought to our organization through her niece. So yeah, please do join one of our Holding Hope groups. We have local groups on Holding Hope Canada. You will find the information. We have local groups. We have also national groups on Zoom where you can join in.
Wonderful. And everybody, the Q&A is working. Apparently chat is disabled. So if you have a question you've been trying to answer to chat, put it in the Q&A. We have a question. Does Canada have a nationwide program about alerting young people in school about the risk of the drug supply? Is there any kind of
There's
proactive education within schools
there's
about?
nothing there's nothing nationwide, and some schools still use a DARE program, which is not only proven to be ineffective, but interestingly, children who go through DARE are actually at a higher risk than children who don't, because those who weren't at risk in the first place, they get really scared, and the others think it sounds interesting and they should give it a try. So research from a colleague, a research colleague in British Columbia, has shown that a harm reduction approach is the most effective approach. Like when you talk to young people about safe sex, when you talk to them about the risk of alcohol, you should also talk about substances, taking a harm reduction approach. And this is something I talk about in some of my other talks as well. But really, as much as possible, we should discourage young people from youth, but also explain to them, if they use, what they need to do to stay safe, because we will never discourage 100% of all young people. There are no national programs. Some of our moms go into schools and speak there. It's hard for us to get into schools because our message is different from what people expect.
Yeah. Thank you, Pam. Maybe for schools, but maybe we'll eventually wrap our mind around it that it's
Mm,
not
yeah,
unlike sexual
yeah,
health and
yeah.
giving people the tools and
There's a
information
program called
to keep
SASSY
themselves safe.
that they use in Vancouver that is a really well-proven program that works well for young
Okay,
people. One of the
good
school
to know.
boards. Mhm.
So if anyone here has those kinds of powers, take a look at that and
Yeah,
encourage that
yeah,
kind of programming in your schools in your province. There's a question that someone who wasn't able to see the full webinar, but so she's wondering whether or not there's a comprehensive document or plan or program that your organization has to be able to know what to ask of politicians and policymakers, and if there's different types of asks for federal versus provincial.
yeah.
If there's if there's somewhere you could point them on a website, or I don't know
Yeah,
if something
that
like
that
this
is
exists.
excellent and something we should do put on our to-do list. I've talked to our I my term on our board ended, and Marie Argyrides and Tracy Letts are now board chair and vice chair. And I talked to Tracy, and they're going to be working. The board is going to be working on policy statements, and they will be on our website. But we are we are a volunteer driven. We have funding for our programs, but not for our advocacy work. It's all volunteer done, but that is an excellent suggestion that I will pass along.
Yeah, it's a great idea,
Mm,
and could really help
yeah,
a lot of
yeah,
groups that are like such as our
yeah,
own,
that's
to
right.
be able
Yeah.
to really amplify your messages.
Mm,
Absolutely. Well, I think the other pieces that are here are comments, and many of them are quite heart are quite touching. And so I just want to encourage everyone to read those comments. And Petra, you may want to take a look at them as well. And a lot of heartfelt thanks to you. So please do take a look at those comments. We're a little bit after 1, and I don't see any new questions coming in. So I wanted to know, do you have any final thoughts or wisdom that you would like to share before we wrap up?
I just want us all to remember the many families that are grieving and the many families that are warring. And if you have someone, if you know someone who's struggling, keep an open mind. What we say, practice love, not tough. Setting healthy boundaries, but maintaining loving relationships. That is what we encourage. So when the person needs you, you have that relationship and there is a door that is open. So I'd like everybody to think about that and support their loved ones in that way, and their friends and family if they know anybody who's struggling. Thank you.
Thank you again, Petra. I really appreciate your sharing all of your wisdom and incredible advocacy with us. And I really hope that many of us who are here today, and I know that many of us who are here today, will be signing up and looking for lots of opportunities to engage. And I think you may have a few new members coming out of this
Good.
webinar as well.
Thank
So
you.
thank you again. I look forward to amplifying your incredible work. And thank you to everybody who joined today, who are interested in this incredibly important topic. Please do what you can to take action, and let's let's stop the harms.
Thank you
Thank
so
you,
much.
everybody.
Bye bye.